Today have the pleasure of talking to Dr. Api. So Dr. Api is a key member within our national COVID response team, and he's a general practitioner and providing support and advice in our communities within Auckland. So today, we're really lucky to have him here. He's going to answer some questions from our Sanford team members around COVID vaccinations. So thank you so much for joining us today.
Kia ora and bula vinaka, Angela.
Thank you. So we've got quite a number of young team members within the team, and they're thinking about their futures and having families. So they're really keen to understand the impact perhaps on their fertility and whether or not it could impact them when they're actually pregnant.
Really good question. And first of all, can I just say how grateful I am to Sanford for organising such a talanoa or conversation. To your members or to your workers, before the vaccine was made available, there were clinical trials of 44,000 people to test the vaccine. 22,000 on one side, they got the vaccine. 22,000 on the other side did not get the vaccine. They got an injection of salt and water. They were exposed to COVID, and that's where they found that 95% of the people that had the vaccine were protected from getting COVID. Now we have 6 billion doses that have been given worldwide, and many vaccinated people, men and women and pregnant women, have gone on to have very healthy babies. So there's been no effect on fertility at all. When we first started, they've had a bit of a caution and said pregnant women should only get the vaccine if they work at the border or if they work in a healthcare facility. But the studies that have been done have shown that it is perfectly safe, no effect on fertility. And I always tell people, Portugal, one of the places with the highest vaccination rates in the world, have actually shown an increased fertility rate. Thanks, Angela.
So the next question, we run a number of shifts here at the Sanford Auckland site, and the team, there's been a lot of discussion around the length of time a vaccination is effective for. So can you tell us a little bit about, is it known how long they're effective? Will people need to have further vaccine shots?
That's, your team are fantastic in asking these questions. And we're lucky in Aotearoa that we can sit here, often at the other end of the world, and watch what is happening elsewhere. Places or countries that have started vaccinating 6 to 8 months before us. What is now evident that particularly for the Delta variant, this more infectious variant, that the immunity that we get from the vaccination starts to drop off or wane. So you'll know in places like the United Kingdom, USA, and especially Israel, they have started to give a booster shot to people 65 years and older, those that have health problems, and to essential workers to try and boost their immunity. Remember, Delta doesn't care, doesn't really respect what your job is, what's your bank account, who you are. It can infect you. And so boosting our immunity, a bit like having the flu injection every year, is a good way of lifting it. New Zealand Ministry of Health has not yet decided if we will do that, but if we do that, it's probably going to be at least 6 months from when you had your second jab.
Thank you. The next question I'm going to ask you about, and it's kind of related, I guess, to my own thoughts. So when the vaccines first came out, personally, I was quite hesitant, and I was worried about the potential side effects, that it was a new vaccine and, perhaps something was going to happen to me. Are there actually any known side effects of the vaccine that we're using here in New Zealand?
Yes, I always tell my patients every injection of vaccine, like every other medicine, has a side effect. Because it's an injection, you will get pain sometimes at the place where the injection goes. You might even have a bit of aching the next few days. You can have dizziness, you can have headache, sometimes even a fever. I tell my patients that's a sign that your immune system is reacting and it's beginning to react to the vaccine to basically build up the immunity that once. So it only lasts 2 or 3 days, and it's a good thing that it's happening to you. I have to be honest, there are serious allergic reactions, what we call anaphylaxis, where you can actually sort of your blood pressure drops and you can collapse. And that's why they want you to wait 15 minutes before you leave after the vaccine. The good thing about anaphylaxis, which only happens about 5 times in 1 million people, is that anaphylaxis can be treated by your doctor, by the people at the vaccination center, or at the emergency department at the hospital.
Thank you. I certainly know, we've got a large number of our team vaccinated already. And one of the most common side effect they've had is a bit of a sore arm from the injection. But other than that, generally no. So that's great news. Dr. Api, on behalf of the entire Sanford team, thank you so much for making this time available to come and talk with me today and answer our vaccine-related questions. We really appreciate, I guess, the work you're doing, with the community, with so many groups coming and talking to Sanford, etc. It is so much appreciated, and we just know that all of this is helping us keep safe. So thank you so very much.
You're very welcome, Angela, and all the best to all your workers.
Thank you.